Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, if you see accuracy of diagnostic methods, right? In the accuracy of diagnostic methods, if on biopsy you have done a gastric mucosal biopsy and you have got a specimen, you have done an endoscopy followed by biopsy and you have got a specimen, and on that if you see that there is a chronic inflammation present, then this is 100% sensitive test for H. pylori infection. But is it specific? No. Then, if you do a rapid urease test on the gastromucosal biopsy, you have got a gastric mucosal biopsy specimen, and on this, if you have done a rapid urease test, urease is produced by H. pylori, so obviously it is a 100% specific test. So 100% sensitive test for the diagnosis of H. pylori infection is chronic inflammation, whereas 100% specific test for the diagnosis of H. pylori infection is rapid urease test.
thank you and thank you for watching.